Good evening, everyone. This is your host, Dr. Yemi Famuyiwa, on our favorite podcast, Fertile Talks. So, this evening, we're going to have a special talk. I want to talk about mental health medications and fertility and what you need to know about this topic. So this topic is it's a near and dear one to me. It was requested by someone close to me to delve into this topic. Okay. So the first thing we're going to talk about is we're going to break this up into segments. Okay. We're going to talk about an overview of mental health medications. We're going to start with some of the common mental health medications out there and their general effects on fertility. So in this episode, we're going to first tackle the most popular used medication, Adderall. Adderall is a medication commonly used to treat ADHD, and it contains amphetamines and dextroamphetamine. So research shows that high doses of this may actually reduce sperm count and motility in men. Now, for women, while direct evidence is limited, the medication's influence on overall health and stress level could indirectly affect fertility. So during pregnancy, Adderall is generally not recommended due to the potential risks associated with premature birth, low birth weight, and neonatal withdrawal symptoms. However, some women may need to continue the medication if the benefits outweigh the risk. Now, there are other medications called SSRIs. Those are the selective serotonin reuptake inhibitors. This include Prozac, fluoxetine, and Zoloft. These are commonly used to treat depression and anxiety. These medications can affect sexual function, leading to decreased libido and difficulty with orgasm in men. It also may be associated with erectile dysfunction and can indirectly impact fertility. So the use of SSRIs during pregnancy involves sort of a balancing risk and benefits. You have to look at the risk and benefits. The use of SSRI in pregnancy may be associated with risks like pulmonary hypertension of the newborn, right, in babies. And also, the babies born may have potential withdrawal symptoms. So we have to be careful about that. However, you have to balance it with the risk of what untreated depression and anxiety can pose to the baby as well as to the mother. Non-SSRI, so this include your things like Effexor, Cymbalta, and tricyclic antidepressants such as amitriptyline and atypical antidepressants like bupropion. These medications may affect sexual function and potentially impact sperm quality with varying effects on pregnancy. So let's look at some recent research findings. All right. There was a study by Solomon, I can't pronounce the last name, Sharvatsur and Azab, that was published not too long ago, that found that there was an association between psychotropic drug use and fertility problems in men. These findings indicate that these medications could have detrimental effects on male fertility, including reduced sperm count and motility. So it highlights the need for awareness and the monitoring of fertility issues in male patients who are taking this medication. There was another systemic extensive review of several studies by the authors Worley and Gurr that looked at the impact of mental illness and psychotropic medications on the gametes. Gametes are your sperm and your eggs, and fertility. And here are the key points that they found. The clinical studies that they examined, that they looked at to come up with this report, did not demonstrate a deleterious effect of psychotropic medication on oocytes, that means the egg, in terms of retrieval and pregnancy rate. The results regarding the sperm were inconclusive. So while some studies suggested an increased sperm motility and quantity with certain psychotropic medications, others have described decreased sperm quantity and motility. Now, for maternal psychiatric illnesses, there was an association with the illness itself with decreased reproductive success, including lower rates of egg retrieval, ongoing pregnancy, and dysregulation of the stress system in most of the studies that they reviewed. Now, male depression, however, did not appear to affect sperm, but anxiety may have had some effect. So I think they concluded that the current literature is not really robust enough to influence how these psychotropics are used in male or female. And then, of course, people have looked at holistic approach, and that approach has to be a collaborative effort and is more nuanced, such as emotional support, psychological support for individuals and couples undergoing fertility treatment. And this is crucial. Comprehensive care involving mental health professionals is also essential. So, lifestyle modification and close monitoring may significantly benefit those taking mental health medication while trying to conceive. Natural treatments such as dietary changes, lifestyle medications should also be considered and discussed with the healthcare providers. And I think also that in people of color, this takes on a more nuanced approach, because with people of color, there's also decreased access to both mental health care and also fertility care. And also there's the stigma involving both mental health and involving fertility. So I think those patients are really should be paid extra close attention to, because they're not going to come forward maybe in a timely fashion or ask the help that they need. So I think we in the medical field should make a special effort to reach out to those patients and reach out to those people who may feel shame, stigma, suffering both fertility as well as mental health issues. So in conclusion, I think there's a lot to understanding the effects of mental health, the medications on fertility and pregnancy, to help us make informed decision. Okay, it has to be a collaborative, comprehensive approach to these patients to find the safest and the most effective treatment plan. So if you have enjoyed this episode, please do not forget to share it, and more importantly, to subscribe so I can keep researching and providing more information with more support from our listening audience. So please click the subscribe button and support us if you can. Thank you once again. This is Dr. Famuyiwa.